This episode is sponsored by VIVARAYS, the only eyewear company that truly understands your biology. VIVARAYS are advanced blue light glasses designed with circadian biology in mind. Unlike typical blue blockers, they filter light in harmony with your body's natural rhythms, helping you sleep deeper, feel more energized, and protect your long-term health. We love companies that support biology-backed wellness, and VIVARAYS is leading the way. Use code QUANTUMHEALTHY at vivarays.com to save 15% and support your sleep, focus, and natural energy the way nature intended. Enjoy this episode. Welcome to the Quantum Healthy podcast. I'm Andeea, a licensed addiction counselor, and along with my co-host, Laura Kissman, a quantum nutritionist, we will be inviting expert scientists, clinicians, survivors, and thrivers to distill their pearls of wisdom attained from applying quantum biology to their fields of research and everyday lives. Our goal is to bring you easy to understand principles and practices about the study of light, water, and magnetism so you can take your health into your own hands. Hello, everyone. Welcome to another episode of Quantum Healthy Podcast. Today we have Dr. Michelle Jeffries on. Welcome, Michelle.
Oh, thank you. It's such a gift to be here with you.
Awesome. I used to be in the skincare field, so I'm super excited about this episode. So she is a dermatologist. She is a triple board certified dermatologist, fellowship trained in pediatric dermatology and integrative medicine, blending cutting edge dermatological science and ancient wisdom, chronobiology, mindfulness, and quantum healing. As the founder of SkinClock Method, she views the skin as vibrant, energetic matrix deeply influencing the body's natural rhythms. And her approach, known as Chronobeauty, goes far beyond prescriptions and protocols, and she helps clients align their internal timing to unlock radiant skin from the inside out. And she has over 15 years of clinical practice and additional certifications, master's degree in psychology, all sorts of things. And we are just so excited to have you. And you truly help people learn how to be radiant from the inside and out. And so we're so excited to talk to you today. Why don't you just start by sharing kind of how you ended up with 3 medical board certifications, a master's degree, and then how you found quantum biology and what opened that up for you?
First of all, thank you for the beautiful introduction. And we were together in the quantum biology training, so it's just so good to see you again and come full circle. So thank you. Yeah, my story starts as, I was not born a dermatologist. And I think sometimes when patients come in, they just expect that my whole life I've known about the sun and skin cancer and, how to take care of my skin. And that was not where I started. I always had an interest in anatomy and physiology and how the body worked. I think I just came into this world with that curiosity, and that has just stuck with me throughout my whole entire path. I think that's my biggest driving factor to continuing to learn and do things. I used to sit and watch cartoons when I was 7 or 8 years old. My parents are still sleeping. I was on our steps, and we had the encyclopedias, and we had the H1, which was a human body. And it had those clear pages where the top page was the outside of the skin, and then you turned it and it was okay, here are the muscles, and you turned it, here are the nerves. And I would just sit there. I'm like, I'm going to learn how all this works. This is fascinating. And I'm watching Roadrunner, something like that. And so I think it just happened that way. And I think my curiosity has just driven all of that. And I feel like there's more layers. There's always more to learn. There's always more going on, and we're evolving. And I think we're just getting in new pieces. So I started out just, thinking I was going to be a doctor. I mean, what else would I do if I was so fascinated with all of those things? And as I got into college, my first year I was there, my high school sweetheart I thought I was going to marry died suddenly in an accident. And then 6 months later, my grandmother passed, who, helped really raise me. I had a very traumatic childhood, and she was a really key part in that. And those two things stunned me to the core. I was like, okay, I don't think I could do the life death thing. I was thinking I was going to be a surgeon and kind of look inside the body and do all these things. And I was like, I can't do that now. I don't know how to handle death and dying. And, I was only like 18, 19 years old. And, then you don't have a lot of resources on how to, what to do with it. My family didn't know what to do. My friends didn't know what to do. They felt bad, but there was not much. And I didn't know to go to therapy or, all of that. Nobody really knew what trauma was then either. So I changed gears and I'm like, okay, I'm going to go into psychology then. I'm still going to help people. I'm still going to be involved on that intimate level, but I'll do it in a different way. And then that lasted until I was in a PhD program in psychology and I was almost done with that. I was like, I have to go to medical school. Like it was eating me up that I had to go. So I would take classes at night to get all of the things I needed to apply to medical school. I applied, got in, and then I didn't finish my PhD. So I left with my master's. And then when I got into medical school, I made a choice of what I was going to do, and I chose to be an osteopathic physician because I wanted to see the body as a whole. I had this background now in life death experience, traumatic childhood, how it impacts your mind, and then I had this fascination with the body. So I wanted to come from a place and be trained in a place that was aligned with the body has this innate way to heal itself. And if we can just accelerate and open those pathways, great. But I also knew people also needed help. We also needed sometimes technology and medications and things like that. And I didn't want to miss that piece either. So that's why I chose that path. And then, as time went on, I thought, I wanted to work with kids maybe. I was focused in my psychological training on resiliency. I wanted to study the kids and the families that overcame trauma, not the ones that had the depression and anxiety, and what was different about those resilient kids that I could maybe transfer over. So I thought, well, I'll just continue my work with kids when I go into medicine. And I had a lot of skin issues and I saw, doctors and dermatologists, but I never put it together that I could work with kids and dermatology and adults in dermatology. So I kind of went the pediatric route first. And then I met Dr. Hansen. He is the one of the grandfathers of pediatric dermatology. And the first moment of my first rotation, we walked in to see a kid with a rash. And the way that he viewed it, the way he analyzed it, it just like was exactly the way I thought. So I was like, okay, this is it. Like I didn't know I could do this. I didn't know I could put this all together. And I was already applying to pediatrics. So it was kind of late in my career and dermatology is very challenging to get into. So I thought, well, I'll do pediatrics and then I'll go into dermatology and then I'll do a fellowship and I'll figure it out. And I feel like when things are in alignment and you're supposed to be doing something, things just happen that maybe never would happen before in other contexts. I completed my first year in pediatric residency, and then a spot opened up in dermatology residency. They started a new fellowship in pediatric dermatology at the same time. This was a time when things were in flux. There were different rules, different things going on, and I was encouraged to apply. So I did, and then was able to, shift over to dermatology and do the pediatric dermatology in tandem. During all of this, after my training, and I did, this combined fellowship training, and I was, I had completed medical school. I did the residency. I did a little pediatrics. I did the pediatric dermatology fellowship, and I was finally at my graduation. And in the midst of all that, I ended up getting divorced very soon before I graduated, and that was a big shift. I became vegan because I meditated and I went to this retreat center and I saw the cows and I was terrified that I actually eat them. So I went vegan, not even knowing what I was doing. I was running a lot to get rid of stress. And I ended up not being able to even walk across the stage to graduate because I was osteopenic and I had a calcaneal stress fracture, which is a heel fracture, which is uncommon, didn't make sense. And we also found out I was vitamin D deficient. And so here I was, like, done all these things, learned all these things, and I was a doctor and I like completed this training and I felt like such a failure and like I didn't know what to even do to heal myself. And so how was I able to like move forward? And I think that's where my like shift into integrative medicine came because I was like, okay, I gotta look outside the box. Like I didn't learn how to, strengthen my bones and my joints and things like that in medical school and nutrition. And obviously, like maybe the vegan thing isn't for me. And, I've been indoors for years studying what's going on with my vitamin D. I've been under so much stress. Like, obviously my body was so depleted. So that really sparked that whole journey. And this was in 2009, 2010, and nobody was really talking about this. So I felt kind of alone until I found the Integrative Medicine Fellowship at U of A with Dr. Andrew Weil.
Oh,
And it was in Tucson. It was like down the street. And it was something that I could do while I was practicing dermatology. So I was like, okay, I'm going to sign up for this. I'm going to do it. And the first day of our fellowship, we had a group circle, and I didn't know who was going to be there. And it was literally physicians from all different specialties who either themselves had a health issue that they needed to rely on some sort of integrative medicine, or it was a family member. And, initially when people are opening up, no one really wanted to talk about it. But as everybody was sharing, it was a very heartfelt sharing of like, okay, I'm like this type of physician and I couldn't find the solution. And I had to go here and it was a vulnerable moment. And here I am to learn so I can help other people go that way too. So that was how that happened. And I feel like the issue with my, bone health and not being able to walk across stage, I don't think I figured out that that was related to circadian rhythm, to gluten issues, dairy issues, nutrition, stress, depletion until much, much later. And when I realized that, and then I came across the training that you can actually have more training, I knew there were more layers. I signed up for that, of course. So that's how it's a long, windy journey, but that's how I got to that training. Yeah.
okay. Well, okay, this is wonderful. Well, okay. So first, one of the things that we're yeah, we have a lot of common. We're learners here. One of the hugest takeaways that I took it from learning about the skin, not only like before when I was in skincare, but then learning quantum biology, is that our skin is really reflective of what's going on inside the body, and that it's a kind of like a communication organ. So before we kind of dive into skin and what that means, could you give us like a layout of the skin so people like, because I think sometimes we forget we need a refresher. So maybe like, yeah, just like a layout, a map. So this way, when we're going through the conversation, kind of frames that.
Yes, and I 100% agree with you. It's like this interface, this portal, this communication device between what's going on inside your body and what's going on outside. And the beauty of the skin is you can see what's going on. And then not only can you see a problem, but you can see the solution working. And so it's just such a amazing organ. So it's this barrier. And then also, if you follow the skin, it is contiguous. It doesn't break. There's not like a skip area or things like that to your internal body. And so the way I describe this is if you were to follow your skin, you can go from your toes all the way, to your mouth. And then if you follow your lips inside your mouth, there's another layer of mucosa, a layer of skin and skin layers. You go down the throat, inside the gut, inside the lungs, inside all of the organ systems, all the way out to the other side. And so that's why we see a lot of nutritional things in the skin. We see leaky gut issues and skin and leaky skin together. It's all kind of one holistic thing. So it's not separate. And to be able to wrap our human brains around, health and wellness and illness, we have to kind of categorize to be able to learn it and to learn the individual things. And then once you kind of grasp that, then you can kind of work on the connections between. And so the skin in itself, it has a bunch of layers. It's not all of a sudden there's this little thin transparent area and then you're inside the body. There's a lot of different layers and there's different thicknesses depending on where you are in your body. There's the top layer of the skin, which is the epidermis. And the really cool thing about the epidermis is we get a new layer in every month. And that is like a rhythm in itself that just has always fascinated me. And if we're going to talk a little bit bigger, we have a female hormone cycle that links every month. We also have a moon cycle that links every month. And so there's all of these different things that are connected. The second, actually, I should talk a little bit more about the top layer of the skin. It's our barrier. It helps with our lipid, our fatty acids in our skin. It has a pH balance. It has microbiome in there. It has nerve endings, touch receptors, hormones. The skin actually has its own kind of axis of making cortisol. It has different nerve endings in there connected to the nervous system. It's not separate. And speaking of the nerves and the blood vessels and the lymph, those kind of dive down to the next layer, the dermis. And that's kind of that thicker layer. When we get an injury there, it tends to stay because it's not one of the ones that rejuvenates. But the mind and the body and the immune system and the nervous system remember. And that's where we get kind of scar tissue and things like that if we injure that to a certain level.
Mhm.
Underneath all that, we have this cushion, and that's our subcutaneous fat. And, fat gets a bad name, but it insulates us. It helps with temperature regulation. We need it. We need it as nutrition. Part of our cell layers have the phospholipids. And so we have a lot of fat that we kind of need for that. So we need to kind of resource that as well. So, and then we go down to the fascia, which is so fascinating. And that actually intertwines in the skin as well. And so we have that matrix that comes in. And I think that was one of the coolest things that the quantum biology training was learning about the hydration of that and how it made a difference. And I don't think I've ever really learned that anywhere else. So just, working with that. Underneath all of that is muscle and then bone. And so there's obviously, a lot of different things and everything's connected. So our mind wants to separate out into these things, but they're not just always separate. They're always kind of contiguous and come together.
Okay.
A question on the fat layer. Of course, in quantum biology, we're always learning about leptin.
Mhm.
And it would the leptin, when we know it as the subcutaneous fat, is the leptin in that fat layer of the skin?
It can be, it's in the fat layer, but it's not just there, right? And so we have leptin receptors as well. So and it's not just leptin by itself. There's a pathway to get there, right? So I think that's probably the biggest thing is that things are never like the one thing. They're always the layers and there's always the pathways. And there's not always one path to leptin. So we know that we can help our leptin by getting some morning sunlight and kind of retraining our circadian rhythm. So that can give the signals internally. So if you just address the fat and then you're not doing some of these other things, you may not quite get that. You might still be leptin resistant, right? If you're not still
Mhm.
paying attention to those signals. So there's
Mhm.
so much.
Oh my God,
There
there is
is.
so. Yeah, I guess I'll just tell the world here, Andeea, that both of us are doing bright line eating, which we had a previous guest on who started it. And she is really addressing leptin with the program. And of course, in the quantum biology space, we've learned about it, looking at leptin using diet, but also very much with, like you said, with the light
Mhm.
and,
Mhm.
and trying to get that communication to the brain working better. So yeah, it's so important to look at both and not just think I can do it with diet alone. I think it's so important to look at the light and yeah, so interesting.
And I didn't even say, but I mean the skin is a light receptor
Okay, that's where I was
too.
going
Like
next.
that. Yeah, okay. I'm reading your
Yeah,
mind.
yeah, I was going to ask you about like, does it contain opsins? And
Yes.
yeah, so melanopsin we've studied a lot with the blue light receptor, and neuropsin is the UVA light receptor. What other opsins are in the skin?
I don't know them off the top of my head. I just think of it as there's these opsins in the skin and the eyes, and they're receptors. And so our body, when we get exposed to the skin, it has a response and it has receptors and it knows what to do with it. We're not meant to live completely covered and indoors 24/7. We're meant to be out in nature. We're meant to have the sunlight. We're meant to have that integration of all of that. And so that's where the nuances of dermatology come into play too. But I don't know all of the science and all of the details behind all of the options. It's something I'm fascinated with and think is amazing, but I don't know all of those details. So if you know more, please share.
No, I just think knowing the little we know of you from just the intro and researching for this, we know you're the curious one. It's going to be the
Yes.
expert soon. So yeah, and the other thing is, do you understand the skin to have clock genes?
100%. Yep. Every cell in your body has clock genes. That was a pivotal moment in my integrative medicine knowledge. A very dear friend of mine who's very well known, we text back and forth and we just nerd out. We met at a functional medicine conference many, many years ago. And I think it's just one of those people you're just friends for life, right? And he'll send me the most random, crazy articles about the skin because he knows I just like, I want to learn, like, what is that? What is that about? And we were talking, I want to say it was like 2017, 2018, about clock genes. And I'm like, how does your skin know how to tell time? Like, seriously? It knows how to tell time? And that just pivoted me all into the clock genes and my whole, methodology of Chronobeauty and the SkinClock method and all of that. And just realizing there is just this innate intelligence, inner skin, inner body that is connected to the earth, that is connected to our cycles. But not only the earth, it's connected to the moon cycles, it's connected to the cosmos, it's connected to seasons. So it's not just, one clock gene. And that is some advice that I now give to patients regularly that I did not really give before was that be sure you're out at sunlight and you're resetting those clock genes and that you're getting that sunlight on your eyes and skin. You're not wearing glasses. You're not wearing sunscreen when the UV index is 0. That's your safe time to go out. Please go out and do that. And if you could be in the grass barefoot, even better. If you can't, that's fine. If you just open a car window, that's fine. If you're at home and you open a window, like be near it, just 2 minutes, something. So that was a big kind of thing I think that shifted also when I did the quantum biology training is I felt more like this is in alignment, this is okay. This is a safe way to do it even despite skin cancer risk because there isn't a risk when the UV index is 0. So why are we, not telling people they can go out at that time? I do have patients that aren't morning people and they're like, I don't wake up to do that and it's not going to happen. So I'm like, okay, you have another chance at sunset. Just watch the UV index and then, you could do it at sunset as well. So yeah, I love the clock genes.
That was our time. Our next question was, how does the skin tell time? And as you're talking, I'm thinking, my skin, my skin doesn't know what time it is. I better open the window because I'm indoors.
Oh,
It's like I was going to record outside, but it's too windy today. So
gotcha.
yeah. Oh wow. Okay. Well, we could go there, but maybe before, just quickly. I heard you say before that 80% of your clients are skin cancer clients,
Hmm.
and I wanted to share that. Andeea already said that she had things in common with you. I'm like a professional student too in different areas. So we all have that in common. But I actually, my college sweetheart, a lot of people don't know this, but my college sweetheart died
Hmm.
too, way too young. And it was from skin cancer.
Hmm.
He did have melanoma. And so we do want to ask you, a little bit about that. We don't want to spend a lot of time because we actually had an episode already with Oksana Hansen
Yes.
as a
Yeah.
melanoma survivor.
Hmm.
So we talked a lot about that, but we didn't get to talk to a dermatologist about it. So just we understand that you like you're, I guess the question is on the cancer part, are you seeing more cancer? Is that why it's 80%? And what other, just very quickly, can you just list what are the things that you see? Like I'm guessing eczema, psoriasis. I'm thinking of skin conditions. Yeah, just scars, tattoos, things like what do you deal with in your practice?
Yeah, you were spot on. So most of what I do are skin cancer screenings on people either concerned that a lesion could be one or that they've already had one and it makes them a little bit more likely to have another one. Melanoma is from a type of cell called a melanocyte, which creates our skin color. Melanocytes are the main cell type that are in a mole as well. And when a mole makes a mistake, when it's making a new layer in it and it doesn't get corrected and it keeps going, it can transition into a melanoma. And that's the word we use for a cancer from the melanocyte not all melanomas are mole colored, which is crazy and very stressful for a dermatologist because some of them are red. It's rare, but you want to pick up on those. Those are more common in people that have red hair. It doesn't have to be, though. There are different types of melanoma. It's not just one thing, and that's kind of back to the layers of things. So it can just be a stage 0 just on the surface. It's called an in situ, just on that very, very epidermis top layer of the skin. Cure rates on that are so high, 98, 99%. You cut out that area of skin, you take a margin around it, and then send it in, make sure margins are clear. You might be at risk to develop a new one somewhere else because of whatever created that spot might still be present. And there's a lot of things we can talk about there too, a lot of layers. But then as it goes deeper in the skin, when we talked about those skin layers, the epidermis doesn't have a lot of blood vessels or lymph, but as you go deeper and as you get closer down, then you do. And so we've developed a rating system of how deep that melanoma, that those cancer cells go, and then does that put you at risk for it going into the lymph and blood vessels and spreading. So there's all these different stages. And then when we get to a certain depth, that's when we think, well, it actually might be in a lymph node. And then we kind of do a procedure to look at the lymph nodes. If it is in the lymph nodes and it's spread, then we want to look at the rest of the body. Where did it land? It can metastasize. So there's a lot of immunotherapy and things we can do now that we didn't have years ago to treat
Yeah.
it and like help the immune system detect those cancer cells and get rid of them. There's a lot of things we can do. And, does all melanoma come from the sun? It can't. Like there's places in the body where it happens, and that's because the melanocytes and in our skin, when we're an embryo, the cells that make up our eye tissue, some of our internal organs, our mucosa, as well as our skin are all developed at the same time. It's our ectoderm. And
Ectoderm.
so it
Okay.
can be inside. You don't have to have a melanoma on the outside of the skin. Those are also very scary. And then you also can have just an ocular melanoma in the back of the eye. It doesn't have to be in the skin, too. So there's all these different like layers and caveats. Now we do know in an area where you've had a lot of sun damage, we are probably higher risk. So that those areas we see maybe a little bit more. And if you do end up having one in those areas, we'll probably recommend to be more mindful about your sun protection in a clean and healthy way, of course, and not using the chemical sunscreens. That's my biggest like frustration with the sunscreens. We can talk about that too if you want. But sun protective clothing, and just covering up is fine and just being mindful of when you're out. The other types of skin cancers we see are just named after the type of cell that does that same type of thing where it grows more than it should, doesn't get corrected. So there's a squamous cell, that is a cell name of a lining. So we have a squamous cell not only in our skin, but we can have squamous cells that line all of our internal organs too, like our lungs. So if you just look up squamous cell, you're going to see all sorts of things. Squamous cell of the skin is a little bit different than the lung squamous cell. And then there's subtypes of those. So there can be an in situ, there can be a keratoacanthoma type, there can be invasive ones, it can be well differentiated. There's, all of those. And then if we have them in certain areas, those also can break off and spread, but they're lower risk to do that. The places where we think those happen are more like in front of the ear, on the head, the lip area too. And so a lot of people are not very mindful about their sun exposure to the lips, in front of the ears and the head. That might be, why they get mixed signals there. Basal cells is another, it's the lining that goes between the epidermis and the dermis. And there's that lining right there, and there's a basal cell there. That is the most common type of skin cancer. There's also subtypes on that. There's superficial, nodular, micronodular, infiltrative, aggressive. There's all these different caveats. And depending on where those are located, they just continue to grow. They don't necessarily go away unless we do something to them, but they don't usually break off and spread and go to your other organ systems, but they can be very destructive. And so, all of our algorithms are based on type of skin cancer, subtype of skin cancer, the size of the lesion, and the location, and then just all of the other kind of factors. And that's how we kind of guide. So that's most of my day. There's other types of skin cancers, like Jimmy Buffett had a Merkel cell, and so that's a different type. There are T cells, part of our immune system, and B cells that also can grow in the skin and create a different type called T cell lymphomas and B cell lymphomas. There's a lot of different types. So when we're looking at, okay, what are we going to do with these? We typically take a sample of them, and then that gives us the information, and then send that to the lab, and they're looking at everything microscopically. So that's the majority of my day. And then just guiding people on like, okay, this is what this is. This is the best way to treat it, and then this is what we recommend moving forward. And then depending on where they're at in their health journey, we talk about supplements and, nutrition, toxic load, gut health, all of these things that, that there is like a level of safe sun. And then like what things are you putting on your skin and could there be a component of that? When we go in those layers. I also see a ton of eczema, acne, psoriasis, vitiligo, warts. And then there's all these different kind of rare things too. So we see lupus, we see dermatomyositis, we see scleroderma. I mean, there's just so many, there's like thousands of skin diagnoses that we see. And we're trained, in our eye and our feel of when we're looking at something to be able to put it in those kind of categories and see where things are. And then also trained in doing the biopsies and the surgeries and things to treat things if necessary, and then the medications as well. So it's a lot that we see. And then sometimes people don't know that they have things. And so we usually recommend, getting a head to toe exam, someone looking through their scalp to see if there's anything, the backside of, bottom of their feet, between their toes, all of those areas that we don't normally look or able to see on our own too. So,
I was going to ask you with COVID, and
mm,
a lot of us not going to the doctor, and then some have continued with telemedicine.
mhm.
Some in Canada, I don't know if you guys have the same problem, but so many Canadians don't have doctors. It's yeah, it's actually frightening how many don't. And so they're not getting looked at. In the old days where the doctor would say, take off your shirt and just,
Yes.
examine different things. Do do you think we're seeing more skin cancers potentially from that reason and that they've gone on too long, like they might have been picked up earlier?
I think it might be one piece, but I don't know if it's all of it. That for sure was a surge right after, like, we never shut down our clinic. We operated throughout the whole thing. We just tightened up our schedule. And it was like if you had a lesion that needed urgent attention, one of us was there. And so we did that. But if it was like routine things, we kind of said, why don't you just wait and see? And so some people waited and then not come back. And we did see rate, as things started opening up, a big surge of things coming in. But now it's kind of like back to, I guess, our normal rate before COVID. But in my career, we definitely have seen an uptick in a lot of skin cancers. And I don't know if it's awareness, if there's something going on in our environment. There's so many things in our foods and our
Toxic load.
soil and our,
Yeah.
technology exposures and
Mm.
just very confusing things about things we're putting on our skin, things we're ingesting in our body. A lot of people, also don't realize that it's kind of when you get, I don't know, when you get a skin cancer, it didn't just drop in that moment. There's something that went on and kind of
Mhm.
happened over time. So it's not like, oh, I got the skin cancer and it just showed up last week or 2 weeks ago or 3 weeks ago. There's some sort of cascade that happened before that, and we don't always know what that is. Sometimes it's stress. And when we get very, very stressed out, our body goes into that flight, fight, freeze, fawn mode. And our skin is left behind, is left in the dust. So it is like if you got something on your skin, your body's like, that's okay. Because if a predator is going to eat you and you have this big weird sore on you, they're not going to eat you. So we'll just let that go. But like, if you need to run from something, we got to make sure your heart works, your muscles work, your lungs work, you're getting the nutrition you need to like pump that in. We're going to store extra fat. We're going to make sure your hair might fall out too, but that
Mhm.
your predator won't want you if you have patches of hair missing either. So we'll just let that go. And I think
I think
evolution,
I've heard you say
yeah.
you've used leprosy. Like
Yeah. Oh,
if
yeah.
someone
Yeah.
had leprosy and someone
Yeah.
had healthy looking skin,
Yeah.
you'd want to go after the healthy looking animal
Right.
for
Right. And
leprosy.
so it's like ingrained in our culture, but it's also
Yeah.
ingrained in our genetics and our response systems too. And what I think is really interesting about kind of the stuff, Andeea, that you've been working with too, and just like the addiction trauma stuff is like that's becoming more soft. Like people that do have wounds and do have things going on, they're not like, they don't have to be silent anymore. They don't have to go somewhere else. Like they can, there's so much authenticity coming forward. And also in skin as well, you see models with vitiligo embracing it and embracing their spots. And, you know, I'm thinking of the book Worthy with Jamie, and she talked about how she developed a whole skincare cosmetic line to help people that had skin conditions to cover the rosacea. And then she took off her makeup and showed what she really looked like under her makeup so that people can see the real her and see that, you know, that that's part of what is happening. So I feel like that's shifting and changing, and people are having a softness, but there's still sometimes that oh, there's something on their skin. What's going on? Can I touch it? Is it contagious? Is there, you know, and that's I think another piece of what happens in the dermatology clinic is, I mean, if you come in as a patient, it's a vulnerable experience. I mean, we want to look at all of you. We want you in your underwear if we can, with the gown on to cover. It's a vulnerable moment when, you know, someone walks in and you're undressed. And, you know, if you've had other traumas or things like that, some of that can be activated in that vulnerable moment too. And so there's that mindfulness of coming into someone's sacred space and looking at them and just seeing, and they're scared, and sometimes what we do hurts. And so there's all these deterrents, I think, of why people don't go. But then if things could be addressed earlier and caught earlier, and, you know, kind of do, you know, things in a less invasive way, the better. So I think people grapple with that. Like, I don't want to go in because it's going to hurt and it's kind of weird and it's vulnerable. And then sometimes they might have had a bad experience with someone that they didn't feel like honored them. So there's all these different parts to that.
Can the skin hold trauma?
Oh, of course, yes.
Yeah. Okay.
Yes, I have a very interesting kind of story about that. I had a woman referred to me. She would have it was a rash nobody could figure out, right? She had been to Mayo Clinic. She had been to upteen dermatologists, upteen like integrative medicine people, you know, just so many places. And her naturopath was a friend of mine. She's like, okay, just go see Dr. Jeffries. I mean, who knows, whatever, you know, you never know. To see another dermatologist, maybe they'll figure it out. And I mean, she did. She had something that didn't make sense. It didn't follow like the algorithmic way we look at skin. And I was like, okay, something's really weird here. Something's different. And she's like, oh, yeah. And it only comes up like a certain times a year. And I was like, oh, well, that's kind of weird. So is it seasonal? And she's like, no, it's like annual, like every like Thanksgiving time. And I was like, okay, that's even weirder. Why? I'm like, when did this all start? And it started when she was, gosh, probably, I want to say she said she was like between 8 and 10, and she was sexually abused under a blanket at that time. And every year since then, she's had this rash come up, and she's seen so many people and put so many things on it. And she had never put together that that was the body's response to her trauma. And then when I was like, okay, well, that's where it started. So now we have a place to go to. So we have a place before that happened, and we have a place now after, but we have that target point. So now if we work through this, I bet you your skin is going to get better over time. So it does. And it has a memory too. It has, you know, immune cells and different memory cells that do that. And then you think of all of the external signals we get at different times a year that enforce that. So not only light, but like seasons and weather and temperature and the foods and all of that. So it absolutely has a memory.
And it has water in it too.
Yes, it
So it has
does.
the consciousness in the water. Oh gosh.
Yes, yes.
Oh,
I
Yay.
love water.
oh my gosh. Thank you for sharing that story. That
Mhm.
was powerful. Okay, so maybe we could go a little bit to water and as one part of this, but could we talk about, oh man, I'm probably skipping a whole bunch I want to talk. Let me just decide here. We want to talk about mitochondrial health, but nutrition. Let's just talk about, because I think of water as nutrition for the skin and it helps
Mhm.
mitochondria as well. But how does having healthier mitochondria in general, how would that help? determine your skin health?
Yeah, so the mitochondria are just our powerhouse of energy. And so it's how we capture and use energy. And I mean, not to go into all the details about mitochondria, but they're passed down maternally. There's some ancestral things and patterns that come through it too. It was thought to be a bacteria that we kind of brought into our cells to help us with energy. It produces light and helps us metabolize light. And so we have in a majority of our cells. And so I feel like there is a network of communication that probably happens with them to help them be in synchrony. How that works, I don't think we fully understand. Could it be transferred through water, through photons, through, all of the quantum kind of concepts of working through it? And then there are, when we look at the electrons in it, when we look at quantum things and we're kind of narrowing it down, there's like an electron kind of transport that goes through it to exchange energy. And so it's almost down to that little quantum level. Bringing it full scope back out to dermatology, one of the things that we found is niacinamide or nicotinamide, which is one of the little cofactors that's part of the body being able to do those electron transport chain. That actually, they researched people in Australia, and one group of people that grew a lot of skin cancers took it for a year, 500 milligrams twice a day. Another group didn't. And at the very end, they kind of tallied up how many pre-skin cancers and skin cancers they had. And the squamous cells were reduced by 23%. So it was like, okay, that was kind of another signal for me that my training in functional medicine and mitochondrial health and all of this, it is relevant to the skin and how the skin in the body is able to repair itself and how it is metabolizing and using the energy. So if we're not fueling our mitochondria and they're not able to do what they need to do, we're going to be depleted on not only micronutrients, nutrients, our quantum energy, our body may not repair as well. And so obviously there's tons of things and tons of supplements and things and exercises and breathing and all of these and water and red light therapy and things that we can do to help support our mitochondria. So,
And also, I guess, to look at what's so hard on our mitochondria too, right? At the
oh
other end,
yes.
right?
Yeah.
Which, I mean, okay, so we've always assumed, well, in the last, I would say, 100 years, that it's the sun,
Hmm.
so maybe we won't go too much into the sunlight protocol today because we had Heather Shepard on and she really detailed it, broke it down for us, how to get sun safely and precondition the skin. Now, I don't know, you may say that you may want to say less, and because you do deal with skin cancer and you're probably advising skin cancer clients more than the average person that doesn't have any diagnoses yet.
Hmm.
But yeah, so let's assume that the sun could be good for the skin, but also too much of it would cause oxidative stress and be harmful for the mitochondria. Are there other toxins that come to mind for you, like makeup,
Yeah. I
uh,
mean, yeah.
pollution, things like
So
that?
so many, right? Back to the kind of the sun exposure, I just think it's more nuanced. And I think it depends on obviously your skin type and where you live in the world and your sun exposure. I have the beautiful gift of living in Arizona. And so our kind of recommendations are probably more intense than other areas of the country that don't have so much sun. We have like around 300 days of the year that have sun, and our sun is super intense. And you really have to pay attention to the UV index and what you're doing. And then a lot of people here have moved elsewhere and live here, and they're in their elder years and have had a lifetime of exposures to a lot of different things. So they're very prone to skin cancer, and that UV might be that last straw for them in that picture. And so the kind of the history in dermatology of sunlight is like it was something we could control. We had like maybe not the best data in, obviously, like that's, known, but we know that like there's a certain level of the radiation of the sun that probably can cause some sun damage, and it was something that we could be mindful and could do things about. It is obviously cascaded in a lot of different directions and a lot of different controversies, but there's always like some truth in all of the things, right? So
Mhm.
there's some truth in like, okay, there's probably a limit to the sun. There probably is a limit to not everybody can do a safe sun protocol, or maybe theirs is just different and very narrow. And other people might be fine. And it might just be that they're able to do it. And I think it just depends on so many things. But the oxidative stress that you're talking about, the main one that comes to mind in dermatology is smoking. I mean, we just see a huge difference when people stop smoking, even vaping. I mean, just a gigantic difference, not only in skin cancer, but conditions like there's something called hidradenitis suppurativa, where you get these very large cysts in the armpit area and the groin area that abscess and connect, and they're very painful and very debilitating. Smoking has been linked to making that a lot worse. So smoking is one. And then, other things in my population, a lot of the patients I see golf. And I feel like there's so much in the chemicals and the fertilizers and things that go into the grass there. And they spend a lot of time out there and they don't always know to do zinc oxide sunscreen. Some of them are doing the chemical ones. And the reason why they do it is it rubs in easier and they just don't want to look like a ghost and look white. And they don't always want to cover up and they're out during the peak hours. And then I also feel like they're drinking alcohol and eating fried foods and I mean, there's all these
Seed
different
oils.
things, but yeah, we do see rashes on certain parts of the hand from them getting the ball, too, from getting exposed to the chemicals in the grass. So I think there's just a lot of caveats, like the kind of the food supply and just they're not aware to eat organic or, things like that. And then you go to like the things we put on our skin. I mean, when I was trained, it was like, nope, none of that's absorbed and everything's fine and there's no chemicals in anything. And obviously in the past 10 years, we've seen, oh yeah, we do absorb it. There's patches you put on the skin to help things. We all know about even estrogen patches for menopause now that, maybe we had a little bit of data of that, but we didn't like link it up to a lotion you're putting on your skin. So there's all of that layer too. And then I just feel like depending on where you're at and your level of pollution too that you get exposed to,
Yeah.
we're very fortunate to live in, Canada and the US, but I mean, you go to some of the third world countries in China and I've been to Egypt too, and just the pollution there is terrible.
Mhm.
So then you're thinking there's all of that layer too. And then the water supply, right? Like what's in our water and are we filtering it and all of those things. And then you can look around like where I am, like housewares, right? And our clothing too, and our hair care products. Like there's just so much. And like, behind both of you, like the paint on the walls and, things like that. And so, yeah, you want to add in plants and, do all the things that you can. So,
I have
yeah.
a friend who has a store dedicated to it's called Toxi Free. So every like looking at everything you just labeled, like everything you just listed off, and having a toxin free version of that. And
Mhm.
that's actually the wormhole that I fell down first, right before I hit the quantum biology rabbit hole. One of the things we wanted to ask you though is about tattoos.
Oh,
Oh,
So
yeah.
tattoos are, in my view, from what I have learned, are basically we give up real estate on our skin to collect melanin. The tattoo is doing that, right? It's not, you're not able to collect melanin if there's a tattoo there. And can you just talk about tattoos and what you see with those?
Yes. And just to kind of one last little piece on the toxins that we didn't talk about that I know you guys
okay.
will also
Oh,
resonate
I
with
know.
is our
You're right.
toxic thoughts and our toxic emotions and toxic people. So
Yeah.
those things too. So just bringing in the mind and the, relationships in there too. So
Okay, so
all of those things play a role
the other
too.
one that Andy and I talked about, we said we have to ask her this. Let's not forget to ask her as a toxin. We see blue light
Oh, yes.
as
Right.
a
Of
yeah,
course.
as a massive toxin. And one of our mentors has this saying, I don't know if you've heard of it, but the fastest way to get wrinkles is to sit in front of a blue lit screen.
Yeah.
Have you researched that anymore other than just hearing that?
I haven't researched it, but I do know that people that have a lot of blue light exposure, I don't know if it's actually the blue light on the skin or if it's the signaling that happens in the body that tells the body that it's awake and then it can't do the detox and repair because it's not able to do the melatonin cycle
Mhm.
as well at night. So that's been my question about it is it really the light or is it kind of it's more so what it does? So yeah, I know we talked about sunrise, but I forgot to add after sunset, avoid all the blue light
Right.
and all of that too. And
For me,
teenagers
I
are
think,
very stunned when I tell them that, but the parents are usually really happy.
yeah, I was going to say for me, the other 100% with the detox, it has to happen or it's not going to clean. But I would love to see more research on the blue light hitting the melanopsin receptors
Right.
and making the vitamin A go rogue. And what does that do in the
Hmm.
body? And what does that do to the skin as well? Because it's at the first layer, right?
Right. Right.
Yeah, I know.
Right. And then
Well,
what are we doing? I mean, maybe some people can have a little bit of that and they have all of the, right internal things going on, like their nutrition spot on, their sleep is spot on, their
yeah.
microbiome's good. And, maybe there's like genetics maybe too, or, environment or mindset and things like that. So yeah,
Like
there's a lot.
I'll use my dad. He's 90, just turned 90 this year. And I was looking at him on the weekend. He's got the skin of a 50-year-old.
Oh,
Like,
awesome.
and
Yes.
he's in front of his TV. He loves movies, current events, so he watches TV every night. He does get outside. He doesn't wear sunscreen. He was in the army, lots and lots of outdoor time. And I just think, is it genetics? Or is it his redox? There's something in his lifestyle and he doesn't take on too much stress, or I don't know.
I mean,
It's like,
joy and
yeah.
presence and being in the moment and happiness and all of that releases all of these little
Mm.
neurotransmitters in our body and we can create that. It doesn't, we decide that. You don't have to have like a certain circumstance. You can decide that inside. And you could tap into that feeling and find it in your body and then just recreate that and recreate that feeling and go back to that as your anchor too. So, and then obviously we want to find things that remind us of that. But yes, like that joy, that presence, that like deciding what is my perspective on this? What if this is just a journey and a project and I'm learning stuff and things aren't so bad and I don't have to get my nervous system all riled up on things like, it sounds like
Mhm.
your dad just like doing his thing. He's happy.
Yeah.
He enjoys what he enjoys and some of us might consider it terrible and a toxin. And I think that's where you just
I
have to have
know.
an
He
open
watches the
heart and
game.
an open like we don't have all the rules. We don't have all of the
Yeah.
things like
And he
people's
plays the
happiness
piano.
is,
Yeah.
their own happiness too. And sometimes that lasts more than, oh my gosh, trying to be so stressed out about I gotta eat the right food. I gotta, get
Yeah.
this sunrise. I gotta do this and I gotta do that. We kind of talked about that a little bit is there's so many things you can do, but like what resonates with you? What makes you happy? Where are you at with it? What does not stress you out too? So yeah. And then circling back to the tattoo,
Oh yeah.
I am by no means a tattoo expert. I have tons of patients that have tattoos. And I think, obviously when we have like, people that might have like sleeves and things like I have some that are covered entirely in tattoos. Then what we're doing is the color of our skin is different. And so then kind of how the sun is being percepted and what is happening is probably changed a little bit. But I do see people with tattoos, they still get tan, they still get sun damage, they still get skin cancers. It's kind of, it might be a little trickier to detect. We do know that when someone does have a biopsy of a lymph node on an area where they have a tattoo, there is dye in the lymph node. Is that okay? Is it not okay? What's the body doing with it? Is it just like keeping it there? We don't know. So, and then there's, lasers that target certain wavelengths in the skin that break it up. And so there are tattoo lasers that can break that up. There's a whole thing about, as dermatologists, we use a ton of light and light devices in our practices. We use UVB lights, we use UVA lights, we use red lights, we use infrared, we use lasers. So I think that's one of the misconceptions about dermatologists is that we're against light, but we actually use it in a lot of different conditions and eczema, psoriasis. We use the UVA one in scleroderma. The red light we use to help with pre-skin cancers. We have a red light device in our office. The lasers are far infrared and infrared lights that we're using to rejuvenate the skin and do things with. So there's a lot of light that we use
Yeah,
in dermatology as well.
great.
So I don't know if having a tattoo, kind of, jumping back to that, does it make you more at risk for skin cancer
Mhm.
because maybe you're not, optimizing your normal skin? I don't know. I think that's what you're asking is like if you have a tattoo and you're not getting the normal light signal, what does that do for health and how meaningful is that?
Yeah, I'm sure
Yeah,
that's, the more of them that you have and the more the skin that's covered up, the signaling would be more off, obviously, if it's more covered. But yeah, no,
I don't know if it impacts your vitamin D receptors though.
that's the question I had.
I don't
Can you
know.
make vitamin D? I had heard that you couldn't, and also
You
heard you
have to
couldn't sweat.
see, there may be a study where they've researched vitamin D levels, but you'd have to do it kind of before and after tattoos and control for,
yeah,
a lot of things. And, you can have those genetic abnormalities in your SNPs of their vitamin D receptors. So I did genetic profile testing and I have that. So I can get a lot of sun and still my vitamin D might be low. And so that's, there's all these different caveats to it too, right?
Do you know the SNPs that's associated with that?
I can't remember it off the top of my head. I want to say that it's like VM. I can't remember. I have to
Okay.
like, I did it like way early in my journey in functional medicine when we were like, we got access to like, oh, do this genetic test to see. So it's probably like 2018.
Okay.
And I can't remember, but it stuck with me because of my journey of the, calcaneal stress fracture and being vitamin D deficient and, all of those things. I was like trying to figure out, well, why, I
Yeah.
mean, we have a lot of reasons why now. I know why.
My husband always that's one of his critiques on our podcast is when someone tells a story that we don't go back and ask them, well, where are you now? But
Oh,
so the
yeah.
question would be, have you improved your osteopenia?
Oh, yes. Yes. So I
Yeah.
still, it's been, so that was, oh my gosh, 15 years ago
Mhm.
now. I was very young. I was in my 30s. So it was like a real, like, whoa moment. I get DEXA scans to check and see, and everything is very stable. It's not like I'm not osteopenic, but it's very, very stable.
It's
And so
stable.
be able to be stable for 15 years,
Yeah.
I do a ton of things for that. I weight train, I run, I do yoga. I am very mindful about my sun exposure, but I do go out at sunrise when I can. I love UVA rise if I can be out there walking in nature. I do take a lot of supplements for that too, for, bone health and things like that. And I guess it's kind of surprising in a way I didn't go into something with bone health, but yeah, it's been a journey. And I just recently had a DEXA scan last year and I was really excited to be in my
Mm.
50s and I was
Mm.
really scared to, kind of just have it go downhill after I hit menopause and a few years after menopause that it would just be terrible. But yeah.
Oh,
you're
that's great.
you're
Really good
watching
news.
this on YouTube. Dr. Jeffries does not look like she's in her 50s.
Thank you.
I'll agree with that.
You're
Well, we're
sweet.
here at time now, and we wanted to ask you our signature question with a twist, I guess. So, what does quantum healthy mean to the skin?
Oh, I think we talked about it in the beginning that the skin is like a quantum portal. It literally will tell you what is going on in the interface between inside your body and outside your body. It'll tell you when it's better, when it's not better, and what's going on. There are things you can do at all the different levels outside of your body, in your mind, in your cells, on the quantum level, and it'll show up on your skin. So be grateful and appreciative of when your skin does something weird, it's showing you something. And please just get eyes on it of a board certified dermatologist so they can help you unwind it. There's a big surge in people being trained in integrative medicine and dermatology. I am a regular speaker and contributor to the Integrative Derm Symposium, and that's a regular conference that's every year. It brings together naturopaths, Chinese medicine, herbalists, estheticians, board certified dermatologists, physician assistants, all different specialties getting trained in that. So it's not as rare to find one now. And some people are able to do remote things, but ideally you do it in person so they can touch and feel it and get to know you too. So the quantum healthy of the skin is just like your guide. It's a map, like you said, Andeea. It's a map.
Awesome. Thank you for that. It's beautiful. So where can people find you?
Yes, I think the easiest way is just on my Instagram at Dr. Jeffries. I post on there regularly. I have online retreat series coming up about how do you be mindful of all of the different clocks that are related to your skin, including your skin clock, and all of the different kind of caveats that we touched on here, and just in a way that you can integrate it into your life. In a busy life, you could do it online. You could do it at your own pace. You can squeeze it in. And it talks a lot about the cycle of things, arising and coming up and being creative in that essence, and then letting things go after they've nourished you, and then being in the space of openness and creation, and how that plays a role in our nutrition, our skin, our stress levels, our hormones, the seasons, manifesting our life, and then our sleep too. So there's a whole program there for you to explore on Instagram. And then I also do have a website that'll be in the show notes as well.
Awesome. Thank you.
Thank you, Dr. Michelle Jeffries. Thank
My
you for
pleasure.
thank you for your time. And time makes me think we didn't talk enough about this concept that I think it's your concept, this of chronobeauty. So please tell us you'll come back. We have tons more questions. We want to get more into nutrition of the skin because I'm a nutritionist. But thank you for just bringing, I guess I got to think of you as the skin whisperer, of that, of these, translating from the skin, what does the skin really want? And it seems to want so much more than just like a beauty product.
Yes.
It needs, low stress and sleep and circadian rhythm. And so excited that you found the field of quantum biology, because like I alluded to earlier, you're going to be that curious squirrel who's going to now have tons more answers for us, leading the way. And and thank you for just really going to the detail about the skin of all the things that, it has like a microbiome, and it's got mitochondria and lymphatics, and it's got its own nervous system, and it's listening to us and watching us. And just finally, I just want to say thank you for all you're doing for skin cancer, that just being that voice to remind us to go get tested. Don't fear the trauma, the minor trauma of going to a dermatologist. It's minor in comparison to what trauma may lie ahead if you let it go undiagnosed, for too long. And as we noted, both you and I we've lost some loved ones along the way. And yeah, skin cancer can be deadly, but it can be minor too, and it can be treated. So thank you for all of that.
Oh, it's such an honor. I really enjoyed talking with both of you. I just felt like we were able to connect on just such a deeper level and able to dive into things that, normally aren't shared on a podcast or in the office, or things that are kind of more one-on-one. And you guys just hold such a beautiful presence and have so much knowledge to share too. And I absolutely love your podcast. I would be honored to be on it again, and we can talk about whatever you like. I would love to. Just thank you so much.
Well, we will definitely have you back. And thank you so much, everyone, for listening. We'll see you next time. Thank you for sticking around to the end of this podcast. We want to thank our sponsor, VIVARAYS, who allows for us to get this information to you. They offer top-of-the-line blue blocking glasses, which, as we know, are critical for our health these days for blocking artificial light at night. Over 90% of our time is spent indoors under artificial lights, and this puts us all prone to circadian rhythm disruption. You can use the code QUANTUMHEALTHY for a discount. Link is in the show notes.
Thank you so much for listening to the Quantum Healthy podcast. We hope you found some value in this information. And if you feel inspired, please share it and leave us a 5-star review. This will help us reach so many more people. If you want to connect with Laura, you can find her at laurakistmanwellness.com and Andeea at andeearay.com. Links are below in the show notes. Now, Go find some sunlight and embrace your own quantum healthy.